The PM said the new plan, expected to be published in the spring, would be, here we go, the biggest reimagining of the NHS since it was formed. Let's run that by Dr. Sean Phillips, the head of health and social care at the right-leaning Policy Exchange. Dr. Phillips, hello to you.
Good evening. Good to be with you.
Yeah, you too. This has generated a huge response in many quarters. Let me put this to you. It's one thing to agree on the diagnosis, and people on the left and the right seem to have a consensus on that, and that the service is in urgent need of reform. But why is it so hard to agree on the kind of reform that's needed?
Very good question. Well, you're quite right. It was like a cold shower this morning, pretty sober diagnostic from Lord Darzi, and to be fair to him, within the remit that he was given was just to provide that diagnosis of the challenges in the system, not to write the prescription. And the government now have the opportunity over the coming months before the spring. There'll be a very important moment, I think, with the spending review coming up, and then exactly as you say, the proposal for a 10-year plan for, interestingly, as I understand it, not just for the NHS, for the health more broadly. And that means that within the remit of that work, we'll be thinking about the wider determinants of health. So that's everything from the houses we live in, because we know that poor quality housing drives poor health. A huge number of government departments, I think at least 12 in some ways, of relevance to that conversation. So a significant piece of work being led by the Department of Health and Social Care.
Yeah, so Sean, it obviously goes beyond the initial remit of the NHS, but just thinking back over the last, let's say 30 years, I've got a long memory, I'm sure you have too. We've had the internal market, the purchaser-provider split, PFI, trusts, foundation hospitals, GP fund holders, clinical commissioning groups, the Lansley reforms, and now integrated care groups. Why have these not worked?
Very good question. Well, I think one conclusion we would draw is that we're pretty poor at learning from prior reforms that have been introduced. I think that is a learning that many reflections that many people have had after they have left government, whether they've been a special advisor, an official. That understanding after we've introduced reforms has been fairly poor. So I think the first thing would be to learn from what we've done previously and what works and what doesn't work.
And what would you say the key learning that runs like a thread through all of those? I think I listed half a dozen. What do you think it is? Because every 3 or 4 years we get some major report or a major declaration, and then somebody like Lansley, or if you go back as far as I remember, Virginia Bottomley comes in with something, and then it's ditched.
I think the most important thing is that this is a significant report, 160 pages, and this is just focusing on the NHS. There's a huge amount. We have to be realistic in political terms what can be achieved over the course of a parliamentary term, and then the vision that you want to set for the longer term. So my advice would be that there should be a ruthless prioritisation, and this is something that I set out in a report for Policy Exchange called Mission Critical, that looked at just the first 100 days, and that said, ultimately, for instance, when it comes to prevention, there's obviously the legislation with respect to smoking, but there's a big focus today on child health and paediatrics. So one of the things that I recommend is that the government look very, very closely at how they can implement their proposals for a child health action plan. So I think that the answer that I would give to your question is that to achieve success, the first thing you need to do is prioritise. What are the things that really matter? What are the things that you can realistically do within a single parliamentary term, with the time you have in terms of to actually introduce legislation, if required, and then at the same time have that theory for change over the longer term.
Sure. And Sean, there's been a call today, and we've heard it a few times, for the NHS to be less of a sickness service and more of a prevention service. And I propose that on the front page of the Times tomorrow morning. Junk food adverts banned before 9 p.m. to take weight off NHS. Now, I'm just guessing you might see that as nanny state, or perhaps, as you're a medical guy, you might think this is exactly the kind of preventive work that we need.
I think the prevention agenda is hugely important. The challenge, I think, ultimately for the government that has always bedeviled governments really has been that, again, you have to be very, very selective there's all kinds of things that come within the remit of a preventative healthcare agenda. So in that sort of pivot to prevention, one of the things that's been talked about today, that, you know, to draw upon the sort of lessons of history you were thinking about early, that shift, how you shift from a hospital focus system to a primary care GP focus system. Well, that was something that Stephen Dorrell was saying in the mid-90s when he was the health secretary. And there's obviously a sort of preventative angle within that. So the first thing is to be really clear about what's meant by prevention, who we what we want the focus to be. And I think there's an opportunity, as I say, with the 10-year plan to really set out exactly what we want to achieve, who should do what, and ultimately over the course, as I say, over a parliamentary term, the government will have to be selective. They've chosen, in terms of the prevention agenda, to focus on smoking. We know now there's about 12%, I believe, of adults who remain smokers. That's a relatively small demographic. But then when it comes to, if we're going to tackle something like obesity, and tackling, I suppose, the food that we eat and the places that we eat it, as a far tougher political challenge, because just the number of people who do want to be able to treat themselves every now and again, etc. So,
of course, a treat every so often, Sean, is fine. But no, if that is your bread and butter, as it were, let me mix my metaphors, then there might be some problems later down the track. Thank you very much for joining us on Times Radio. That's Dr. Sean Phillips, Head of Health and Social Care at Policy Exchange. Your